Welcome to this lesson on knowing when to seek professional help and utilizing therapy. Seeking professional help and therapy in relapse prevention is so crucial when you're facing challenges related to substance use or addictive behaviors or any situation where maintaining positive changes in your life is difficult. Seeking a therapist's services is not a luxury. If you ask me, I'd say it's a necessity. It's a necessity. Here are some specific situations in which you should consider seeking help and therapy for relapse prevention. When you experience cravings and urges, it's time for you to seek therapy. Persistent cravings or urges to use can be difficult to manage on your own. So therapy can provide strategies to help you cope with these urges if you have tried all and it doesn't really work out for you. Another time when you need to seek a therapist is when you have relapsed. You can look for a substance use recovery coach and ask them to help you get through this time. There is no point thinking that you can do it on your own. You have tried it before, it did not work. So you need them to help you through this challenging time. If you have already experienced a relapse, it's a clear sign that you may need additional support. So therapy can help you understand what you missed out on, the triggers and underlying causes of the relapse, and develop strategies to prevent future ones. Another time when you need a therapist is when you face high-risk situations. If that lady didn't have me as her therapist at the time, when she had that high-risk situation, she wouldn't have known what to do. It will have increased the risk of her relapse because she may have found herself being forced to use, and therapy can help you navigate those challenging scenarios effectively. I use that example for you to understand this when the time comes. Another time when you need a therapist is when you encounter emotional challenges. Emotional issues like depression, anxiety, anger, or trauma can make relapse more likely. Remember what we said in the beginning, unresolved trauma can make relapse more likely. So therapy can help you address those emotional challenges and provide the necessary coping skills tailored to you. Very, very important. When you lack support is another time when you need to get a therapist. If your current support system is inadequate or unsupportive of your recovery efforts, therapy can provide the additional support and guidance that you need. So find a therapist that can help you. Another time you need a therapist is when you need relapse prevention strategies. A therapist can help you develop a personalized relapse prevention plan tailored to your specific triggers and needs. This plan can be an invaluable tool in managing your sobriety or behavioral change. Another time when you need a therapist is when you want to strengthen motivation. It can help you boost your motivation for change. A therapist can work with you to explore your goals and reasons for wanting to maintain positive changes. That is another time. Another time is when you seek accountability. Having a therapist can provide a level of accountability that can be instrumental in maintaining your commitment to change. This is what I did for that lady and what I do for quite a number of people. Accountability. I help people go from active addiction to sobriety. If you're looking for accountability after going for in-treatment, if you are in recovery, this is my job, aftercare, to help you stay accountable to your goals. It can provide a level of accountability that is instrumental in maintaining your commitment to change. Another time is when you want to learn coping strategies. Therapy can teach you strategies to manage stress, cravings, and triggers effectively. Another time is when you desire long-term recovery. So important. If you're committed to long-term recovery and want to ensure that you have the skills and support to maintain it, therapy is an essential component of your recovery plan. When you have experience dual diagnosis. If you have a dual diagnosis, meaning you're dealing with both substance use issues and a co-occurring mental health conditions such as depression and anxiety, therapy can help you address both aspects simultaneously. When you want to improve the quality of your life, therapy helps you work on personal growth, improving relationships, enhancing your self-esteem, and overall life satisfaction. When you need guidance for lifestyle changes, making lifestyle changes such as adopting a healthier routine can be very daunting and challenging. A therapist can help provide guidance and strategies for lasting change. When you are unsure of your next steps, if you're certain about what steps to take in your recovery journey, a therapist will gladly, conveniently help you clarify your goals and develop a plan. So it's important that you remember that seeking therapy for relapse prevention is a proactive and positive step in maintaining your sobriety or achieving your behavior change goals. It provides you with all the tools, all the support, and guidance needed to navigate the challenges that may arise on your path to recovery and long-term well-being. You can reach out to me if you need a personalized aftercare plan. If you need a therapist, you can reach out to me. If you need to engage the services of a therapist or you need a personalized aftercare plan, you can reach out to me. At the end of the course, you will see my details on how to reach out. Kindly reach out and we can do this together. Thank you and see you in the next lesson.